Hi, everyone. I want to talk about the CDC guideline on the diagnosis and management of mild traumatic brain injury among children, but I also want to talk about some supplemental documents that are really helpful. My name is Wendy Elmo, and I'm a speech-language pathologist and a brain injury specialist with Brain Links, and I worked for many years at an outpatient brain trauma unit. So the guidelines themselves came out in JAMA Online in September of 2018, and they contain 19 clinical recommendations in 4 areas. And along with those guidelines, they came out with some supplemental documents that are really helpful. The first is on the diagnostic recommendations, and they break things down into neuroimaging, neuropsychological tools, and serum biomarkers. The next area is prognostic recommendations. They are on counseling patients on prognosis, evaluating for premorbid conditions, assessing for risk factors, use of tools for predicting prognosis, and interventions for poor prognosis. The last 2 areas are put into one document. They are management and treatment recommendations on general areas of treatment, symptom and problem-specific areas. And the CDC really wanted us to focus on 5 key takeaway points or key recommendations from the guidelines. One was to not routinely image patients to diagnose mTBI. It's not needed all the time, and they talk about some specific times when it is necessary, and I would refer you to the guidelines for that. To use validated age-appropriate symptom scales to diagnose mTBI. Keep in mind, there isn't anything from 0 to 5. Someone's working on them. We hope that they're out soon because the little ones really present a little bit differently, so we need to clue the caregiver into what they're looking for. And then assess evidence-based risk factors for prolonged recovery, provide patients with instructions on return to activity customized to their symptoms. So we are not just giving out blanket accommodations. What we're doing is taking a look at their symptoms and then giving accommodations that will fit that, because if we know that if the care provider gives recommendations or accommodations to the school is much more likely to use them. So we want that to be happening. And then last, to be counseling patients to return gradually to non-sport activities after no more than 2 to 3 days of rest. And this is really a big change for the way from the way we used to do it, which was putting someone in a quiet, dark room for a week or for 2 weeks or until their symptoms went away. And what they found is that actually will prolong symptoms. So we need people to be getting away from that. To get to more of a 2 to 3 day rest period if that's needed, and then to get back into daily activities as they're able. So that might mean getting up, getting dressed, making breakfast, maybe getting on the bus, and then maybe having to come home. Maybe the next day they make it a half a day. So it's really whatever they can handle. We're looking for them to do that. And then the next supplemental document, the 4th one, is on a return to school letter. And we have now had the opportunity to show this to many, many primary care providers in Tennessee, where we are, and they are loving it because it is really easy to use. On the front, you check off the symptoms. On the back, you can check off accommodations and check off whether they're cleared to school and for what. And then the 5th supplemental document to the guideline is a checklist. It's like a flow sheet for thinking in a way, and it looks at assessment, counseling, and referral. And that referral piece is so important because we know that there are, if you take a look at our video on the 6 types of concussion, you'll see that there are active treatments that are evidence-based now for concussion treatment. So we want folks to get referred for that symptom-specific treatment as soon as it makes sense to be doing that. And you can find all of these supplemental tools in our toolkit, and you can find that at tndisability.org/brain. You will also find more reference information, and you will find tools that you can use in your clinic for diagnosis. And you can also find some really great tools that we recommend sending home with the families. We know that family education will help with outcomes, and there are some really great ones in this toolkit. So I thank you so much for tuning in for some more information on the guidelines, and I hope that you will go and download the toolkit.